Messieurs les présidents, et globalement chers amis, avant de vous lire un petit propos
Ladies and
sur la
gentlemen,
journée
dear
qui nous
friends,
attend,
just before I wanted to talk to you briefly what is going to happen today, I wanted to talk to you briefly about a history, almost an anecdote. It's 1994, I'm a parliamentarian, and as part of a parliamentary friendship group, I met some African delegates. Obviously, we're speaking together very freely, and I say to one of them, and so what do you do usually on a Sunday? Usually, I know exactly what a French parliamentarian does on a Sunday. He says, we go to a funeral. And I say, how is that possible? He says, yes, of course. Drugs are too expensive. And there are many funerals of young people that we have to attend. That was in 1994, a long time ago, a very long time ago. And this answer, this reply, I never forgot it. How expensive the drugs was a true issue. And so the foundation decided to fight against this problem wholeheartedly. Today's meeting, I believe, is going to help us see the possibility is not to solve the problem forever, but at least to try to fight against the expensive price of drugs. And so the fact that we're going to be talking about this together and the fact that I'm here with you all today really moves me. First of all, on behalf of President Revol and Béatrice Direct, our director, welcome to Andoise, the home of the Foundation, for this colloquium on universal health coverage in Africa. In order to talk about what is currently at stake and our future prospects. UHC is basically in every single speech today, and that's a good thing. There were a lot of questions, a lot of assumptions, a lot of ideas that were launched. But today, this coverage is becoming a reality, and that's a good thing. The anecdote that I just talked about is proof that obviously financial barriers are a major obstacle for the access to care of the people of the Western Hemisphere, of the Southern Hemisphere rather. The lack of health structures, of staff, of drugs and trained personnel are just as many obstacles to health services. In countries where most of the population lives with less than $2 per day, the cost of care that is paid for almost fully by the population is often an unbearable obstacle. And to have the reflex to go and use whatever drugs you'll find on the street is a normal reflex. Anybody would say, why don't you go to the pharmacy? Well, that's basically because these drugs are cheaper. And it makes it very difficult for anyone to actually overcome this problem. Traditional practitioners will be the first reflex that people will have, just like counterfeit drugs, and an accident or a chronic disease can obviously cause a lot of financial problems, if not misery, complete misery, for a whole family. So the fight against discrimination regarding access to health care means that we need to consider the offer of health care, which has a cost, and how to overcome these costs, especially for fragile states and fragile populations. It is part of the responsibility of the states, but it's also a matter of solidarity for communities, countries, and the international community. Public health actors cannot disregard this question even when it's not their responsibility to respond to this. The Pierre Fabre Foundation, in compliance with its commitment to access to care for the people from the Southern Hemisphere, decided that it would be necessary to start sharing best practices around this topic, and it is now a priority of the agenda of World Health. As you will see today, the paths to progress of universal healthcare will be different depending on the local context, the political vision that is implemented, or also depending on the human and financial means. But we have a lot of questions that are common questions, and everybody's experience can actually help and inspire others. And that's why we are very lucky that we have here with us today very high-level speakers who are experts of public health problems in Africa, with specific countries represented here like Senegal, Mali, Gabon, Ghana, Ethiopia, and Rwanda. They will be able to actually help us understand how to better implement a policy that includes access to care. Edi Asu is here with us today. She's an expert of economic and social questions in Africa, and she accepted to be a moderator for this debate and to moderate the whole day. Welcome to Andoise and enjoy this conference.